Yeah. Hello, my name is Kendall Davis, and the article I read was Teaching Children with Autism to Engage in Conversational Exchanges, Script Fading with Embedded Textual Stimuli, and the authors are Sarkoff, Taylor, and Paulson. The question asked during the article were if stimuli were used that had embedded text, the script could be faded and children with autism would engage in conversation in the presence of the stimuli. So basically saying that children with autism would engage in conversation in the presence of a stimuli with an embedded text such as the word Skittles on the package of Skittles. So the dependent variable in this study were the number of scripted and unscripted statements made by each participant during the session. The independent variables are 2 sets of snacks and 1 set of video game cases with embedded text. Each item was placed on a paper with a script, and the script had about 6 to 7 conversation statements related to the item. IOA was observed at 80% of the sessions, and IOA had observers on opposite sides of the room, and when a statement was recited from the script, a check was placed on the data sheet next to the statement. Unscripted statements were recorded word for word. Agreement included both observers placing a check or absence of a check next to the statement in the script and recording the same words from the unscripted statements. IOA was calculated by dividing the number of statements by the number of agreements and disagreements, then multiplying that by 100%. During baseline, IOA was 100%, and during intervention, it was over 90%. Treatment fidelity was not provided for this study. During baseline, textual scripts and prompts were not provided to the 2 students. During intervention, the students were seated across from one another and the scripts with the embedded text were presented. The students were able to engage in the activities when the scripted statement prompted them to do so. Prompts were provided when needed, and eventually the statements within the script were slowly removed. The results were Lou, a 7-year-old in the Day Education and Treatment Center for Autism, talked during baseline when Skittles were present. Once the scripts were introduced, he engaged in all the scripted statements and unscripted statements. Jack, a 9-year-old in the same center, made a few statements during baseline, and his statements increased when the scripts were introduced. The conclusions of the study showed that the use of the scripts with stimuli with embedded text were effective in teaching Lou and Jack to engage in conversation statements about the stimuli. As the script was faded along with the other text, the participants maintained conversation statements in the presence of the items. There are a few limitations to this study, and the first one were that snacks and games were not contingently available during baseline, which may have caused an increase in motivation because access to the items were based on reading the scripts. Second was using embedded text can limit conversations about the past and future events because the text will not always be available in the natural environment. Third is responding in the absence of an embedded text was not assessed, and the fourth limitation for this study was the assessments on generalization should be interpreted with caution because no pre-treatment data was collected. So I hope you enjoyed watching.